We're DR Management. We're here to relieve the stress from the management side of your practice so you can concentrate on what makes you the most successful, treating patients.
We are a practice management company. We primarily do billing and collect money for physicians. In addition, we will help them with public relations and marketing. And in addition to that, we'll help them with human resource to make sure that they're properly staffed, to take away the stress and strain of practice management and the day-to-day operations of a practice from the physician so that they can concentrate on what makes them the most success, which is treating patients.
DR management makes my life much easier when it comes to hiring many new employees. Whenever I do need a new employee, within approximately 2 to 3 days, I have about anywhere between 2 to 6 applicants that I have in the office that I can go and interview, and that process really makes my life much easier.
We understand that you didn't become a doctor so you could manage an office. That's why we specialize in insurance, billing, marketing, public relations, and human resources, so you can be a doctor.
You know, you didn't get into to being a doctor to manage an office. You didn't get into being a physician because you wanted to worry about collections and worry about insurance payments and worry about marketing and worry about human resource. You got into being a doctor to heal. You got to help, and that's what you want to do. And you know, you should concentrate on being able to do that and get the most success possible for yourself and for your practice. And that's what we try to do for you.
I feel that DR management is a valuable asset to my practice in the fact that it allows me to be more of a doctor than to worry about every little function. They provide us with support from a marketing standpoint. We get billing help getting in new patients, help as far as training new staff is very crucial, so that when they come into the position, they at least have the background knowledge of what they had and what we expect in each position, and then we can get them comfortable with it through experience. We work closely with the office. We have direct lines, and there's always somebody who's able to answer our questions. If somebody's interested in billing help or marketing help or different types of management services, they provide it all, and it's definitely helped us tremendously.
The right match is important so you can achieve the results you want.
Well, first of all, we got to see if there's the right fit. When we're trying to find somebody that we can service, we want to make sure that we actually will be able to provide them the product that we would like to achieve, which is their net profitability. So from our standpoint, you know, we're not interested in just picking up clients for the sake of having additional people in our coffers. It's more of like a partnership of sorts. You know, we can collect all the money we possibly can. We can make sure the bills are going out. We can generate new patients, and we can definitely make sure that you're well staffed. But if this isn't going to take the stress level off of the doctor to allow them to really concentrate on patient care, it's really not the right fit. So we have to go in and analyze a practice and make sure that their goals are something that we can actually give to them. So it's more like a partnership than it necessarily is a customer type of relationship. It's more of a partnership. So the first thing that we do is we go to see if there's actually a match, whether we can actually provide the doctor with a better service, collect more money for them, and take the stress level off them.
If we didn't have them, we'd have to have a lot more work to do. Things would take a lot longer to do because you'd have much more work to do, and you wouldn't be able to get back to the patients in a timely manner, versus with having them, you can. So it would take a lot more work if we didn't have them.
The right management partnership will create the efficiency you want so you can increase your top line with more patients and decrease your expenses for a better bottom line.
What we're trying to do is to make sure that we can have a very smooth transition. We want to determine, you know, what time frame we're going to set up a battle plan that's going to go through mechanically what things we need to do so that we can start taking over the billing functions. If the doctor also wants, you know, to generate new patient volume, wants to improve their referral stream, those are all things that we can do to help them. So we've got to find out what exactly the doctor wants and set up the chronology of how to implement that through a battle plan. Once that's actually done, then we'll go to the next level, which is get approval, make sure that the transition can happen, get the computer systems, you know, up, running, and ready, and basically turn it on over.
It helps my practice grow. It helps with a large number of new patients, and we've seen a very nice number of new patients over the past 4 years, and it keeps growing.
So what we give the doctor the ability to do through our marketing campaigns and through the public relations services that we do render is what we're trying to do is to increase your top line by getting more patients in, but also decrease the expenses that you have so that you have more net profit at the end of the month, which is really the way to win in medicine today.
Now, what would you do without DR management?
Dr. Rosen would probably have less hair.
We have billing people who know what they're doing that can collect the money. We have an IT guy that is top in the field. We have marketing to be able to get new patients in the door, and we've got human resource to be able to make this happen.
We're DR Management, and now you know what we can do for you. Relieve the stress from the management side of your practice. Streamline insurance, billing, marketing, public relations, and human resources. Because with the right match, you don't need to manage your practice. You can be a doctor.